Hi friends, you know that in a matter of few days, all the people, mainly Muslims around the world, are fasting during the holy month of Ramadan. Usually it's a 29 or 30 days long fast. The hours we fast are 12 to 22 hours a day. This runs in various seasons, maybe summer, winter, or rainy season, or any season, because the lunar month falls short of 10 to 11 days each year. This year in India, this is during the month of April. This is a fairly hot, humid weather in Kerala especially. So you know that around 100 crore people or 1 billion people fast every year. There are people with different ailments, diabetes, hypertension, dyslipidemia, epileptics, Parkinson's, stroke, cardiac illness. So all sort of people fast in spite of our advice. You know that fasting is not a must for people who travel, those with subnormal intelligence, those who have some certain disease or diabetes, hypertension, or other major illnesses, or those who are pregnant, lactating, or some other comorbid condition. It's not at all required. But in spite of that, people do fast. So that means we have to give an awareness to the patients as well as to the doctors who treat people who fast during the holy month of Ramadan. You know that 5 crore people fast with diabetes every year. Those people who have diabetes mellitus. There are basically two types of diabetes, insulin dependent and insulin non-dependent. 49% of the insulin dependent and 79% of the non-insulin dependent diabetics fast during this month. And the complication would be around 4.4 in insulin dependent and the 5-fold increase in the complication in non-insulin dependent. But largely it is safe, largely. But you know that people, even in spite of advice, they do fast. That is the problem. So what are things you should be careful? Before you start the fast, you should always check your blood sugar, your HbA1c, your creatine and other blood test. So that you know that whether you are fit to fast or whether there would be any complications during the fasting year. So basically, the fasting gives you immunity. It would boost your immunity. It would give you more longevity. If you reduce the calorie by 20%, this would definitely increase your lifespan, especially proteins. And there are only two things, to the best of my knowledge, would increase your longevity or lifespan. One is fasting, decreasing calories. Second is maybe the use of the one drug called metformin for diabetes. This proved that it would increase the longevity with many other good aspects related to that medication. So you know that during fast, generally we should have an idea what to do and what not to do. So in diabetes, let me explain what you have to do in a diabetes. So avoid a larger meal and use with complex carbohydrate, those with a rich in fiber. It's better that when you break the fast in the evening, take a lighter diet. We should include the fruits, cut fruits, nuts, non-salted things, and maybe some light food. Maybe after 1 to 2 hours, you can have your major meal. That should be, you should avoid the sugars, the sugary drinks and shakes and all. But you can use lavishly fruits and other things. And maybe vegetarian, non-vegetarian, depending on your taste. I would prefer not to use, especially during this hot month, because the hot, humid, you would be dehydrated. If you use red meat like mutton or beef, this would increase the uric acid, and the chance of getting a uric acid stones is very high. You should keep yourself hydrated very well. Okay, otherwise the chance of getting a dehydration, the complication related to dehydration, stone formation, uric acid stone formation and kidney stones is very, very high. And maybe late night, maybe around 10 o'clock, you can have a light snacks or something. And by in the morning, you should always have a light snacks. Don't take a heavy meal in the morning. You should continue your lifestyle modification in diabetics. You can have a mild exercise maybe 2 hours after the breaking the fast. Maybe by 7, 8, 8 or 9 o'clock, you can have the prayer, the Tarawih prayer and all, or some walking or something. Maybe 20 to 40 minutes every day should be good. And secondly, if you are using metformin, like suppose if you take metformin 1 gram twice daily, keep 1 gram during the evening and maybe 500 milligram during the early morning, just before starting the fast. If you are using glibenclamide, better avoid it and change to some other medication. Repaglinide is fine, then gliclazide is good, as well as the gliptins and the pioglitazone, acarbose are all good. So you can have all this medication, but preferably avoid glibenclamide and glyphosine, that is dapagliflozin and empagliflozin. Unless there are pressing indication to use this dapagliflozin, like in cardiac failure, better avoid this medicine, because this would cause more urination and problem during the fasting. And glibenclamide has to be stopped, man. If you are using drugs like glimepiride and all, it is better to, if it is get morning and evening one, make it at least one during when you break the fast in the evening, and maybe half tablet in the morning, or maybe just one tablet only. But always be careful that you should monitor the blood sugar very frequently. And if the blood sugar comes down, if the fasting is less than 60 milligram percentage, or during the fast at any time, if the blood sugar comes to 70 milligram, you should stop the fast, you should break it. Or if the blood sugar goes up more than 300, always be careful that don't continue the fasting. So the blood sugar has to be monitored very frequently. And gliclazide is a good one, glipizide is a good option, and glimepiride is a good option. Gliptins are very good options, but avoid glibenclamide and dapagliflozin. Insulin, if you take twice daily, like suppose you take 20 in the morning and 20 in the evening, it is better to continue once in the evening and check the blood sugar frequently. If it goes maybe instead of 20, you can increase to 30, and if it is still uncontrolled, maybe you can have a low dose in the morning, and maybe you can add a regular dose of insulin maybe in the evening and in the morning. Okay. And continue the dietary management, the lifestyle modification, the mild exercise, and frequent monitoring of blood sugar. And if the patient has got a stroke, so always continue medication for stroke like aspirin and clopidogrel. Sometimes this would be taken during the noon time. This may be shifted in the evening, maybe in the 8 p.m. or 10 p.m. like that. If the patient has an anticoagulation like warfarin or acetone, it's always instead of we used to prescribe by 6 p.m. in the evening, because there should be a gap of 2 hours before and after the meal. In the same way, you can take this medication by 10 p.m. at night. Don't skip anticoagulation, don't skip antiplatelets, and all the drug has to be taken. Suppose these patients with Parkinson's, who are taking 3, 4, 5, 6 times a day, it's known that during fasting this would get worse. So if you have if your relative has got a significant Parkinson's disease, better avoid fasting. Or if the patient is still insisting on fasting, you can instead of the three dose in the morning, you can take at night, or maybe you can take a longer acting medication like a Sindopar, depending on your physician's opinion. All right. If the patient is an epileptic, don't skip the dose and don't skip your sleep. And you should take one tablet in the evening and one tablet in the early morning, maybe just before sunrise, maybe around 4 o'clock, and should be continued without fail. And if you skip a dose, it's very highly that you get a fit. So don't skip meal, and the sleep has to be in good order. Okay. And if the patient has got a kidney failure, better avoid fasting. But if the patient really insists of fasting, then you should ask him to the regular intake of the medication as well as the proper hydration depending on the allowed fluid intake. And if the patient has a significant cardiac failure or angina, chest pain, myocardial infarction, post angioplasty, post bypass graft, better avoid fasting. if there is any undue fluctuation in the blood pressure, the breathing difficulty, breathing abnormality and all, better avoid fasting. But if the patient is well maintained, the patient is stable, you can continue. Depending, you have to continue all the medication as prescribed. Maybe you can switch the drugs to the morning and evening, and you have to take the advice of your physician. Monitor your blood pressure frequently, sodium and water, sodium, potassium, calcium has to be monitored, blood pressure has to be monitored, blood sugar has to be monitored, and if there are any fluctuation or any abnormality, it's better to avoid fasting. Okay, children need not fast, but if they really insist on taking fast, they can have the normal diet. There is no restriction for them, but avoid the fast food, avoid the fried foods and very heavy sugary drink, but they can have a normal nutritious high calorie diet. And pregnant people don't fast, and if they really insist on fasting, I would say don't fast. But there are people, in spite of our advice, they do fast. In that case, the fluid has to be maintained, fluid intake has to be increased, and the diet has to be appropriate, calories should be there, and there shouldn't be any BP fall or dehydration or something which would impair either the fetus or her well-being. Okay, so you know that fasting improves your immunity. This would give you increase your moral fiber. This would reduce all your stresses, your anxiety, depression, phobias, palpitations, and depression and all. This would definitely give a impetus on your moral and social well-being. Similarly, that this would decrease many diseases. It has been studied in animals models, and it would reduce the incidence of autoimmunity, autoimmune disorders, increase heterogenesis, malignancies, cancer, diabetes, hypertension, renal, respiratory, cardiac illnesses. So it has been proved. It would definitely increase your immunity, it would increase your longevity and increase your lifespan. But it would be further improve your health if you stick to certain baseline. Don't take more calories during Ramadan, and the fluid has to be taken in a normal good manner, and avoid very high calorie diet, fried food, salted drinks, salted food, salted dry fruits and all. So avoid all these salty things, very high calorie, fried items, fast food. Mutton and beef may be reduced in quantity because this would be slightly more atherogenic. Take more vegetables, more cut fruits. Egg white is good, fish is good, chicken is okay. So you can continue everything, and instead of taking a very heavy meal at a time, you break to 2-3 portions, especially in diabetics. So I would urge you to stick to, you have to talk to your healthcare provider or doctor and talk to them in detail regarding the management during fasting, regarding diabetes, hypertension, coronary artery disease, stroke, anticoagulation, epilepsy, Parkinson's, asthmatics, cardiac failure, CAD and all. So everything has to be checked. So usually if the patient is well maintained on medication, nothing would occur. But if there are any abnormalities like a fall in blood pressure, increase in heart rate, or breathing issues, chest pain, or getting a fit, always consider your doctor, and you may not be able to continue your fasting. Okay, so I hope I could give you a bird's eye view on this particular topic of fasting and the various related problems, both in healthy as well as in disease states. And if you got any queries or questions, you are welcome to do so. Okay, thank you very much.